among our midst. The elderly men and women who depend on and trust doctors, and the families who depend on and trust lawyers. To the doctors who would ignore or abuse the plight of the elderly, we say, send medical arrogance straight to hell. S-M-A-S-H. Smash it. Send it where it belongs. Smash the wall of silence. And to the lawyers who would ignore or make light of the plight of the families of the abused elderly, we say, send legal arrogance straight to hell. S-L-A-S-H. Slash it. Send it to where it belongs. Slash the wall of silence.
But I'd like
Don't
to know,
you have the courage to stand up and be a voice for justice? After all, the only way evil can succeed is if good people do nothing.
What I'd like to know is, are you going to change and promulgate new regulations? I'd like to know, are you going to release the Joint Commission findings? I'd like to know, are you going to increase the frequency of the Joint Commission review of hospitals from the 3 years to the 1 year? I'd like to know what you, yourself, take it upon yourself to make certain to push this legislation and regulation now, not next year, now. Get started now. We're here. We're here. And these things are before you. What are you going to do? It's time for a change. This is supposed to be a change here. Are we ever going to change, or we're just going to let it continue? What are you going to do? Tell me one thing you're going to do. Tell me one thing you're going to do. Just one thing between the two of you. What one thing are you going to do? Tell me one thing.
Let him answer. Is that an answer?
I didn't hear anything.
I'm not going to do things that are handed to me on a list. We work really hard here. Listen.
What are you going to do?
Listen, your stories are tragic, heartbreaking, horrendous.
You're not going to do anything.
Sir, this is not like a political forum here. You know,
it's a very political situation, though. You can't.
Unfortunately, we deal with that too. I have been trying to do something about the malpractice laws since I got here. I've worked very hard trying to do it, but we too hit up against politics and other factors. And you've got the trial lawyers on one side, you know, you've got the hospital associations on the other side. There are different points of view, and then you've got the Assembly and the Senate. It's not easy for us either. It's very, very frustrating, but I am continuing to try to get those laws changed. That's what I'm focusing on now. But we have 100 lawyers here who have, some of their jobs are to do regulations, and I'm going to find out about SO 46-48 and find out who's assigned to it and what they're doing and what the delay is. But
okay, while you're there, let me give you another number. AO 9270.
AO 9270.
Yes.
I would also like to re-emphasize.
Hold on a second. Were those?
Let her finish.
Hold on a second. Were those both passed by the legislature?
They're bills. They're waiting to be passed. They need your help.
Oh, we can't. Wait a minute. We can't do regulations for something that hasn't been passed yet.
No, but you can be prepared. The regulations would be passed, and you can lobby in order to push it to be passed. And once it is passed, what are you going to do? Now you're going to wait another 2 or 3 years before you promulgate regulations? Do you have the regulations? Are you preparing for the law to be passed? I know you're not even aware of the law, but the bottom line is, now you are aware. So you should be trying to prepare to create some regulations for this.
It's not fair of you to criticize me for not being aware of that. There are so many laws that so many people want changed, and I'm working on a piece of it. I can't work on every one of them, but there are people here working on every one of them.
And I would like to emphasize that the laws that are supposed to be protecting the patients are not being enforced.
That's
absolutely. More regulations to ignore.
The sham of the supposed investigation in my father's case was exactly that. No one sat down with me.
Who investigated the case of your father?
It wasn't investigated. There was no investigation. I handed them the
sham
evidence.
of the investigation. Whose sham was it? Who?
Starting with Aqua Watch Leach in your Suffolk office, who refused to investigate. I wrote all the way up to the commissioner, and they basically told me, don't ever call the DOH again. I handed them at great expense piles of evidence, and they just threw it in the garbage.
I had the same experience. Case closed, don't bother us anymore.
I am telling you, if you sat down with me with the medical records, I would point out exactly where. I could show you chapter and verse, all the evidence you need that should have cited this hospital for brutal patients.
Ms. Gessner, did you talk to OPMC?
I filed 2 complaints with OPMC, and it went right back out to Suffolk
right now.
These were hospital issues. This was the willful failure to follow universal precautions by hospital staff and brutal abuse by aides and nursing staff. The evidence is in the medical record, despite their great effort to cover it up. I am a very educated woman. If you sat down with me with the medical record and the affidavits of witnesses to the abuse, you would know what I'm talking about.
Well, I think we can all prove our cases. That's why we're on the line. The problem is not in the proof. The problem is in the failure of the systems to protect the people.
You're dealing with knowledgeable, educated people who've done their homework very, very assiduously.
Well, the regulations are not
our facts. We have our facts. We have our I certainly have affidavits of merit from professional doctors, and I'm sure many of the other people here have as much evidence as they could possibly. I mean, I don't know what more we can show you or tell you. I mean,
well, Dr. Morley has offered to speak to those doctors, and I'm going to look into these couple of statutes. We're going to continue to try to do work to prevent these things from happening. That is the best that we can do.
What is going to be done about the things that have happened?
Ms. Cohen, when can we call you again? Can we call you next week, next Monday, for another conference call?
No, I cannot have regular conference calls in which we discuss this. I can't have a regular forum in which we discuss this.
Why not?
You don't want to do anything. You don't want to.
Why not?
She doesn't want to do anything.
Mrs. Cohen, you said
well, can we contact you individually?
When can we contact you?
Never.
To continue this we opened the door today. When can we continue this
dialogue?
First of all, you've got to pick representatives. I can't have 10 people competing to yell at me. And so if you want to have the initial conversation that was planned with 1 or 2 people, if you have, I think you should write to me a list of the things you want done, and then we can answer the letter.
Can we have your address?
It's the regular State Department of Health, room 2438.
2438?
Yep.
Is that the legislative office building?
No, Corning Tower.
I'm on a letter writer. I'd like to speak to someone.
Well,
my case is very involved. It would be a book. So I'd like to see, you have 100 lawyers there. Can you assign me 1 person?
Well,
this is Marie Pascalski. The murder of my mother at the nursing home, which began a negligence at a hospital, and the doctor is still there as of last week because my mother's horror began 24th of November, 1998, and suffered 28 straight months.
First of all, nothing,
just want a person to see.
Just putting me in a position of sounding like somebody who doesn't care about these things.
You didn't say that.
I do care, and it's really horrible. I have elderly parents who've had their problems in hospitals. Nothing like what you've described, thank God.
Nothing will if they know that your parents have a lawyer that's an attorney.
I don't live in this state, so that's not true. Okay.
We'll see.
Their daughter is an attorney. They'll take
Would you
care of
better if it did happen to my parents?